Well, good morning and welcome to Scarborough Town Centre. Happy St. Patrick's Day. Maybe the alternative to drowning the shamrock, as they say this year, is to drown the virus in vaccine, and that's what we're here about, and that's why we're here, and we hope that that's going to get another boost today with the opening of this and other clinics across the city. And I'm very delighted to be here with Councillor Joe Cressy, the Chair of the Board of Health, with Chief Pegg, who's had so much to do with the fact that these clinics exist and a lot of planning that went into that, and with Dr. de Villa. Now, we always get mentioned and we always get centered out at these kinds of things and do the talking. There is one more person who happens to be here today who I want to acknowledge because she's been such an indispensable part of this team of getting all this work done, and that's Melissa Gennaro, who's standing over there and who is always off to the side and out of sight, but who's been a huge part of the immunization task force work that's been done and that continues to be done, of course, each and every day. So, Melissa, thank you for all of your efforts as well. So we are literally minutes away from something that we've been planning for and waiting for throughout the pandemic. We started to work on our part of this, including the mass immunization clinic. It's one part of what we're doing before there was even a vaccine that had been acknowledged or announced. But we have come to the day when the first of our, well, three actually, but this one being one of the mass immunization clinics run by Toronto Public Health and by the City of Toronto will be open. It's part of a much broader Team Toronto effort to getting everyone vaccinated, and the other partners, and there's many that will ultimately be on the list, but right now it consists of clinics operated by our hospitals, healthcare partners in the community, pharmacies, and mobile clinics, and there'll be others added, including, of course, doctors, as determined by ourselves and working with the provincial government as well. As I mentioned, we started planning for the vaccine rollout before a vaccine was even approved, because we knew that this effort, being not just incredibly important to the health and well-being of the people, but also the largest vaccination effort of its kind ever carried out in the history of the city, pardon me, was going to be key to ending the pandemic. Yesterday, we all had the opportunity to visit the second of the three being here at Scarborough Civic Centre, Town Centre, the Metropolitan Toronto Convention Centre downtown, and the Congress Centre out by the airport. We had the chance to visit the Congress Centre and see what was happening behind the scenes there as they got ready. And again, it was very impressive in terms of just how organized it was. And in fact, these clinics have been ready for some time. The furniture has been here, the staff has been hired, and everybody's been kind of ready to go, and we've only been ensuring that we had the proper supply so that we could in fact get going without interruption. And so today, here in Scarborough and at the other two clinics, we are ready to move forward with the vaccination of residents 80 years of age and over, born in 1941 or earlier. A lot of them have already been vaccinated, upwards of 40,000, but there are many more that will be done through these clinics. This is as a result of the fact that we have a somewhat greater stream of vaccines available to us today, thanks to the Government of Canada. And we are obviously hopeful now that we can continue with this work and, in fact, ramp it up until the job is done. What is the job? Well, the job is very simple. It's shots in the arms of as many Torontonians as we possibly can do. Ideally, you'd get every single one done, and we're going to work towards that and have as many done as possible, as quickly as possible. And we won't stop until every single Torontonian who wants to be vaccinated is actually vaccinated. This will rely, of course, on a large and steady supply of vaccine from the other governments going forward. The daily and weekly throughput of this and all of our other clinics can be increased to almost 1 million doses in a month. We're ready to scale these clinics up and inoculate more people every single day, but reliable vaccine supply, of course, is a must. And I'm confident that that vaccine will come. It is coming. We've been given some anticipated shipments of vaccine from the other governments going forward, even for the rest of this month. And I'm confident we will have all the vaccine that we need because both the provincial government and the Government of Canada understand the importance of getting our population safely vaccinated and getting Toronto, which is the economic engine of Canada, firing on all cylinders again. It's not just important to people who live here. It's vitally important to them and to this region and to this province. It's important to the country that this city get back on its feet in every respect. People be healthy and well, and that also be back to work again. A healthy economy requires healthy people, and that is something we've said throughout. The 3 city-operated centres operating today are fully booked up for the next few days, which means we will be vaccinating 450 people per day at each site. and this number can be scaled up as circumstances permit, in particular supply. The clinics will be operating 7 days a week from 11 in the morning until 8 at night. And as we've indicated, those kinds of things can be re-examined as we see what demand is and, of course, most importantly, what supply of vaccine is. And that is on top of all the other work that I've mentioned that is happening with our hospital and healthcare partners and pharmacies and doctors' offices right across the city. It's a huge team effort. In total, Toronto is vaccinating thousands of people every single day, more than 300,000 doses so far, and counting, of course, as of this morning. Everyone is involved in working hard to get people vaccinated across the city from all walks of life. So I want to say something that is very important at this stage, which is to say thank you to the staff. And it's not any one group of staff. It's people who work for the city. It's people who work for our different first responder services who are taking an integral role in the well-being of the people here and of these clinics operating properly. It is the healthcare partners that we have. It's a whole lot of people that helped us to get these clinics up and running safely. Everybody involved has been a part of our ability to get the clinics going and to now roll out the service to people, hopefully on an expanded basis as we see more supply become available. When residents show up for their appointment, they can expect top-notch service provided by staff who are ready to take them through a very seamless and easy process. And I think, as you saw, there are not many steps to this because it's been thought through in a very careful way. Every single detail has been thought of so that people here can be comfortable and can find it an easy experience for them. And as the number of appointments booked goes up, I'm confident the number of people vaccinated will also continue to increase and more people can get their shots. We're ready to deal with that in terms of the plans made by the city together with our healthcare partners. So one of the most important messages from today, from me as the Mayor, from Councillor Cressy, from Chief Pegg and Dr. de Villa, we all joined together in strongly encouraging people who are eligible, those for the moment who are born in 1941 or earlier, to please book your vaccination appointment now and get vaccinated. It's not just about getting the appointment. That's going to be helpful to make it an easier experience for you and help us to know that we're getting through the population, but it's because it's so important that people get this done sooner than later, because the protection, starts, soon after you've had the vaccination, and it can't start if you don't have one. Please go to COVID-19, ontariohealth.ca, or to toronto.ca COVID-19/COVID-19, or contact the provincial information line at 1-888-999-6488. We know some people don't use email or use social media, and so if they don't, there is a call center there with lots of people ready to answer the phone and help to make the booking of the appointment seamless as well. So I just want to conclude again by saying thank you to all of those who have got us to where we are today. It's St. Patrick's Day, so that hopefully the Shamrock is on our side as we cross our fingers and not just hope that the clinics are successful, not just hope lots of people sign up, not just hope that those people stay healthy, but just hope that together with spring that we can put this behind us if we work together, continue to follow public health guidance and get vaccinated. And I think if we do all those things, there's reason to believe we can be back to a somewhat better life, somewhat more normal a life by sometime not too far from now. We're all now available for questions for those of you who have any.
Mayor, you alluded to getting some information about coming vaccine supplies. Is there anything you can say about what the time frame would be for this clinic to be working at max capacity, or is there anything you can elaborate on that as far as increased supplies?
I will just say Chief Pegg, and I'll ask him to come up and speak to it. He outlined very specific dates on which we've been given very specific numbers, as to vaccine shipments, and those have to be, of course, taken across the responsibilities that we have, the clinics and other places. But we are getting pretty specific information. I'll ask Chief Pegg if he wants to just go over that again.
Thank you, Mayor Tory, and thanks, David. So this, of course, today we start, and if I may use maybe a silly analogy, but this is the way I feel. It feels to me like this is a very large aircraft. We spent the last number of months taxiing it into position on the runway, and today's the day that we start to bring the thrust levers up and start to take off. We start today at 450 doses a day in each of our 3 clinics. That scales now progressively over the next number of weeks. March 29th, that capacity increases. April 5th, it increases again, and we're on track, assuming that the forecasted vaccine availability arrives, when we are told it will, that on or around, at some point on around, I would say April the 12th, we're on track to be operating at our planned capacity in this clinic and the rest of our clinic networks, and that would mean that more than 3,000 doses a day will be administered here, and the corresponding amount in the rest of our clinics. So really excited to get that going.
And Chief Pegg, does that change anything as far as the decision about whether to extend hours at some point?
Yeah, David, you and I have had some really good conversation about the extension of hours, and like Mayor Tory said, that decision is almost entirely based on the supply and availability of vaccine. Nothing would make any of us happier than being in a situation where we have enough vaccine in order to have the conversation about which clinics or all of the clinics that we need to expand hours, and that certainly can look at overnight hours in 24, but the driver for that is the availability of vaccine.
You guys, Mayor Tory, on CP24 this morning, you talked about the possibility of opening restaurant outdoor dining before indoor dining. Can you tell me, is that something that might happen soon, or what's the thinking, or where does that come from?
We are having daily discussions with each other and also with the province with respect to, first and foremost, what the health conditions are. And of course, we've seen in recent days, very serious expressions of concern about the case counts not only having stagnated, but perhaps starting back up again, and of course the variants at the same time. But at the same time, we're seized of the fact, I've said all the way along, and I repeat today, we can't just take into account, although it has to be the most important factor, the health numbers, but also the psychology of people, the reality of the region and what's going on around us, and the state of the economy. And so we're looking for ways in which we can, identify things that are a possibility to do, less to do with color codes and more to do with just the realities of what people face in their lives, and how we can make sure that proper health concerns and proper safety and caution on that side is matched with reality on the other side. So there's nothing been decided. There's no things that have been given a green light by anybody, including us or the province, but we're in discussions on all kinds of options that could be safe, but could at the same time be, realistic in the context of people and their lives in our city.
So if Toronto wanted to, say, stay in the grey zone but allow some things, including outdoor dining, would we just need the province to amend the order, or how would that work?
Well, obviously, everything you discuss with the province is in their hands in the end. The framework is theirs. Changing that framework, if they ever did, which they did, for example, with regard to places of worship, is their decision. They listened carefully. I think they've been very respectful of the Chief Medical Officer of Health in particular, and also people like the Mayor of the city in looking at what our wishes are. Those discussions are ongoing. I would say they're constructive and productive. We're also talking to Peel because the two regions, the City of Toronto and Peel, are in the same position at the moment, surrounded by others who are in a different position. So, those discussions continue, and obviously we know that people are anxious to know if there are going to be any changes. And I would just say, for the moment, all speculation aside, including any started by me, please, don't take any decisions based on speculation. Wait until the actual word comes, because there's a number of levels of decision making that have to happen, hopefully in a reasonably short period of time, to allow people to know what's going on.
And this question for you, Dr. de Villa, that yesterday I and many other reporters talked to medical experts who increasingly say we're either in a third wave or a continuation of the second wave, and that they're very concerned about variants, and there is a message of don't open up at all. Is there anything any of you could say to that message we're getting?
That, I have no idea why you included me in that question. That is definitely a Dr. de Villa question. I'm not a medical doctor. I'll ask Dr. de Villa to answer that.
Thanks, David. And I appreciate that that's a question of interest for many people, right? Continuation of second wave, beginning of a third wave. I think we can debate that until we're blue in the face. At the end of the day, the numbers are actually not moving in a good direction. We can see that. But I think what's really important here is that we know, even with the emergence and the increase that we're seeing in variants of concern, what works is distancing. And we know exactly, we have public health measures. We know what the self-protection measures are. And we know that those continue to be the most effective method for us to participate in our efforts to fight against COVID-19 while we get vaccines rolled out. And so the other element that's really important, I think, in this discussion is ensuring that people actually do take up their opportunity, their turn to get vaccine as soon as their turn comes up.
And so if there's a race between vaccine and variant as to which one's going to get in Torontonians first, who's winning right now?
Well, I think that's up to us. right? I think to the extent that we are able to really continue to be vigilant around public health measures, to be vigilant around the measures for self-protection, we're doing everything we can to put out vaccines through clinics such as this. So I would encourage people to continue those self-protection measures, to really stick to their home as much as possible, limit their interactions to the greatest extent possible, get the vaccine as soon as your turn comes up, and these are the things that will put us in the best stead.
Just one more thing.
It is St. Patrick's Day. We are living in a city that is surrounded by a region that has more opportunity, shall we say, to go to places and enjoy St. Patrick's Day parties. And I just hope people will enjoy, City of Toronto residents, enjoy St. Patrick's Day in their own homes with their own families, just for this once. I've promised, and I will keep my promise, we will find a day on the 17th of a month later in the year when things are better, that we can hoist a pint of green beer and have a good time and celebrate everything Irish, because everybody likes this at least one day a year where everybody claims to be Irish. But please, this is one of those kinds of occasions where people sometimes will say, well, just today, I'm going to make an exception and get together with my friends and have a couple of pints. Please don't. Please just celebrate with the people you live with, and we'll have a better celebration another day. I think it's a very important message. Every day we can follow those public health guidelines is a day that's going to help us to win this war. Thank you.